By the power vested in me, I hereby constitute this assembly as a legal congregation of the University of Pretoria. During this assembly, degrees with all the associated rights and privileges will be conferred to the candidates whose names appear in the program. Please take your seats. Ladies and gentlemen, we request you to join us in silent prayer or meditation to give thanks for the achievements of our graduates. Thank you. Ladies and gentlemen, as Vice Chancellor and Principal of the University of Pretoria, I extend a hearty word of welcome to you at this graduation ceremony. I'd like to welcome a number of people, specifically as individuals and categories of people. First, the recipient of an honorary degree, Dr. Tedros Ghebreyesus, the Director General of the World Health Organization. The Dean of the Faculty of Health Sciences, Professor Tian Diaha, the Deputy Dean for Stakeholder Relations, Professor Flavia Sekuwoge, the Deputy Dean for Teaching and Learning, Professor Vanessa Steenkamp, the Deputy Dean for Research and Postgraduate Education, Professor Tivani Mashamba Thompson, the Registrar of the University, Professor Caroline Nicholson. Categories of people, chairpersons of schools, heads of departments, directors, emeriti, and honorary professors, and other lecturers, their spouses, and their partners. Representative of the Student Representative Council who will present the SRC academic honorary colors. All persons to whom degrees will be conferred to this afternoon. All spouses, partners, parents, and other parties, as well as dignitaries who we may not be aware of. I now request the Dean to introduce to me the candidate for the honorary doctorate.
Mr. Vice Chancellor and Principal, I have the honor to introduce to you Dr. Tedros Adhanom Ghebreyesus for the conferment of the degree Doctor of Medicine honoris causa. Dr. Tedros was elected World Health Organization Director General for 5 years by the WHO member states at the 70th World Health Assembly in May 2017 and was re-elected for a second term in May 2022 during the 75th World Health Assembly. He is the first person from WHO Africa region to head the world's leading public health agency. Dr. Tedros was born in Eritrean city of Asmara. He graduated from the University of Asmara with a Bachelor of Biology before earning a Master of Science in Immunology of Infectious Diseases from the University of London, a doctorate in Community Health from the University of Nottingham, and an honorary fellowship from the London School of Hygiene and Tropical Medicine. Following his studies, Dr. Tedros returned to Ethiopia to support the delivery of health services, first working as a field-level malariologist before heading a regional health service and later serving Ethiopia's federal government for over a decade as Minister of Health and Minister of Foreign Affairs. As Minister of Health from 2005 to 2012, He led the comprehensive reform of the country's health system, building on universal health coverage, and provided services to all people, even in the most remote areas. Under his leadership, Ethiopia expanded its health infrastructure, developed innovative health financing mechanisms, and expanded the health workforce. A major component of reforms was the creation of a primary healthcare extension program that developed 40,000 female health workers throughout the country. A significant result was the approximate 60% reduction in child and maternal health mortalities. As Minister of Foreign Affairs from 2012 to 2016, he elevated health as a political issue nationally, regionally, and globally. In his role, he led efforts to negotiate the Addis Ababa Action Agenda, in which 193 countries committed to financing sustainable development goals. Before being elected as Director General of WHO, Dr. Tedros held many leadership positions in global health, such as Chair of Global Fund to fight AIDS, tuberculosis, and malaria, Chair of the Rollback Malaria Partnership, and co-chair of the Partnership for Maternal, Newborn, and Child Health Board. After taking office as WHO Director General, Dr. Tedros initiated the most significant transformation in the organization's history, which has generated a wide range of achievements. In summary, Dr. Tedros' enormous, exceptional contribution globally during the COVID-19 pandemic and over the years in the field of public health and epidemiology as scientist, global health expert, diplomat, and advocate, together with his innovative leadership to reshape global public health, has been unmatched. It is therefore with great honor, Mr. Vice-Chancellor and Principal, that I request you to confer the honorary doctorate on the candidate.
I hereby confer the degree of Doctor of Medicine honoris causa with all its associated rights and privileges on Dr. Tedros Adhanom Ghebreyesus. Congratulations. I now have the honor to request Dr. Tedros Ghebreyesus to address the Assembly.
Thank you so much, Chancellor Kampepe, Vice-Chancellor Kupe, Dean Dijegar, to all dignitaries, graduates, students, faculty and staff of the University of Pretoria, dear colleagues and friends, including my family, my wife Kudist, Brooke and Belen, who are with me today. Let us begin by remembering the words of Nelson Mandela. Education is the most powerful weapon you can use to change the world. As some of you are aware, Nelson Mandela Madiba was awarded an honorary law doctorate here at the University of Pretoria in 1997 for his commitment to equality, justice, and reconciliation. And in fact, the first time he came to speak at the university, 6 years earlier, he was shouted down by an angry crowd. But as we all know, he persisted, and for that, we all triumphed. The lesson there is twofold. Never stop trying, because things can change for the better. And so today, I accept this honorary doctorate with both great pride and humility. I'm grateful to be an adopted member of the University of Pretoria family. The university is known for its standout work in disciplines including engineering, economics, business, microbiology, and plant and animal science, including important work on malaria that I share. I am a malaria expert with the Dean. Please accept my warm congratulations to all graduates today, and to your families and to your mentors. As graduates, your journey does not end today. It's just beginning. You have gone from being a student in school to a student in life. I was asked to talk a bit about my own journey, so I thought I would do that by focusing on 4 themes, rather 5. First, anything is possible. Second, challenges come with opportunities. Third, continuous improvement is important, change as a constant. And fourth, humanity first. I think the 5th one, the last one, I will tell you when I end the speech. It's a surprise. First, anything is possible. As a child growing up in Ethiopia, I saw firsthand the effects of violence, poverty, and disease in my community. And I belong to a poor family. As yet today, here I am, Director General of the World Health Organization. It's certainly not something I ever expected would happen, because when I was a child, my mother's only prayer was for me to survive just a day. So what's the lesson there? A better future is possible. And in the meantime, work hard, because you never know when you may face a great challenge and when your chance to shine will come. The second point then is challenges come with opportunities. When I took on this role as Director General of WHO, I did not know that we would soon face an Ebola outbreak in North Kivu, in the Democratic Republic of the Congo. This was a place of unrest and violent conflict. It took 2 years to contain, working long and hard with our partners in government and in the communities. In the process, we lost 2 of our colleagues, murdered in cold blood by armed groups who operate in North Kivu. Of course, Ebola was followed by the COVID-19 pandemic. This was a challenge on many levels. As you know, unprecedented challenge. This was a new disease which we had never seen before. and it was accompanied by a second pandemic, a pandemic of misinformation and falsehoods. WHO also faced significant pressure due to geopolitical confrontations, nationalism, and the politicization of COVID. The only way to deal with such extraordinary difficulties is to stay focused on your work, following the science and the evidence, and to keep people at the center of our efforts. And that's what my colleagues and I did throughout the pandemic. So when the challenges come, as they always do, you must be prepared and you must be ready. As I often say, the time to fix the roof is before the rains come. Which brings me to number 3, continuous improvement, change as a constant. That means learning lessons by assessing where we have been and where we're going. WHO was founded 75 years ago in the aftermath of the Second World War in 1948. Over 3/4 of a century, WHO and our partners in countries and communities had many accomplishments: eradicating smallpox, pushing polio to the brink, global curbs on smoking and trans fats, increasing life expectancy. We have played key roles in the fight against diseases like HIV, TB, Ebola, malaria, measles, you name it. At the core of our work is the belief that global cooperation and solidarity can help us to reach the highest possible level of health for all people, everywhere, as WHO's Constitution says. Throughout, our focus is on continuous improvement. These transformational changes began even before the pandemic, as Dean indicated earlier. As Director General, my priority is to make sure that WHO is ready to take on the challenges of the next 5 years. This includes strengthening our health emergencies, science and data programs, improving the global health architecture, and focusing on country impact. We're also working to nurture future young global health leaders from Africa and around the world. It's critical that now, with the recent challenges of COVID-19, we learn its lessons. Profound inequities badly undermined our work to contain the pandemic, especially in the unequal global distribution of life-saving tools like vaccines, tests, and treatments. It was a clear demonstration that the global system is in need of repair and rethinking, because health for all means all, rich and poor, north and south, east and west. To address these inequities, WHO and partners established the mRNA Technology Transfer Hub here in South Africa. Local production is critical to preparing for the next pandemic or epidemic. 15 countries from Latin America, from Africa itself, from Asia, Europe, are collaborating with South Africa to ensure local production and address the equity issue. I visited the hub yesterday. The progress is remarkable, with huge promise for increasing access to vaccines of COVID-19, but the technology of mRNA can also be used for HIV, tuberculosis, and other diseases. WHO is also committed to supporting the Africa Centers for Disease Control and Prevention and the Africa Medicines Agency, because as we look to the future, Africa should never again be the last in line to receive vaccines, tests and treatments, and other life-saving tools. So whenever you have challenges, take it as opportunity to find improvement. That's what I try to do every day. And I remember often where I came from and how I got here. It's truly a privilege and an honor to work at WHO. The fourth theme is humanity first. Whether you go on to work in the public or private sector, please always put humanity first. These pandemic years clearly demonstrated that nationalism and selfishness hinder progress. They do not help. When I say nationalism, narrow nationalism. Of course, enlightened nationalism could be okay. It's also clear that health must be at the center of all we do. As you have all seen, health crisis can affect societies, economies, and stability. When health fails, everything can fail. Make no mistake, dear graduates, my colleagues and friends, you're graduating at a very difficult time in the world with a climate crisis, profound inequality, major conflicts and wars, and injustice. We must put health and humanity first, with solidarity and global cooperation, because the world does not get better unless we work together to make it better. So, throughout your careers, keep listening and learning and trying. Try everything. Because, as Madiba taught us, we can all make a difference. And that takes me to the fifth theme, which I kept. This is about my son, my daughter, my son are graduating today. Pave the way. That's a song I selected for you. Brenda Fassie. And all the best, and I thank you. And again, thank you so much for this great honor. And when I take this honor, I take it as recognition for WHO. Proud to be WHO. Thank you so much.
Dr. Tedros Adhanom Ghebreyesus, thank you very much for your address. Your own personal story, the story of the organization that you lead, the World Health Organization, is testimony to turning challenges into opportunities and making a difference locally and globally. Thank you very much. I now request the Dean to introduce to me the candidates present whose names appear in the program.